Hi everyone, this is week 4 in community wellness, and this is the first week in epidemiological content. So I'm going to spend a little time talking about some of the important um, concepts that you're going to be learning about, um, and hopefully make this a little more enjoyable. This is really the basis for what happens in community and public health. So it's an exciting topic, and I hope that you do learn a lot from it and really enjoy the content as well. You've really started looking at some of these issues, and one of the important ones this week, and that's dealing with environmental health. So your content, your comments, your responses to all of the environmental issue reports that you completed and the discussion board online really have been very interesting. And again, I always enjoy reading through those. So um, as we start this content, I am going to call your attention to some of the PowerPoints as well, just so that I can reference what is occurring. So, like I said, we're going to think about a lot of the concerns in the environment during this first part of the PowerPoint. And as you begin your readings, you'll see that we're bombarded by all kinds of exposures, chemical, biological, physical, and even the buildings and equipment that we use sometimes can cause issues for us as professionals and certainly also in our private lives as well. One of the things that is in your textbook too that I just want to call your attention to is the ANA scope and standards for environmental health. So it really does, these are a nice set of guidelines that define a nurse's responsibility for environmental health. So please read through those because they are important to think about. I have commented this or put this in responses in a number of places, but we really, as nurses, when we conduct an admission assessment or are talking to people in other healthcare sites, including content on the environment is so important because it can have such a huge impact on someone's health, especially if it deals with respiratory issues. But as you read through the content this week, you're going to see that it really can impact many areas of our lives and certainly of our health as well. So the first PowerPoint that I just want to, again, call your attention to is on page, let me get there, on page 5. These are the 4 environmental principles that are so interesting. Some of them very true and some we don't want to believe in anymore. So I just want to point to them and then talk about some of the kinds of pollution that we see. First of all, the first one is very true. Everything is connected to everything else. We cannot dispose of something or um, make a change and it in some way doesn't impact something down the road. Um, Everything has to go somewhere. We do have to find safe methods of disposal. That certainly is critical as we think about environmental health. Number 3 is absolutely wrong. The solution to pollution is dilution. We can no longer use our waterways and lakes and oceans as dumping grounds. Eventually, they're going to hit a turning point where they're not going to come back and that the water is unhealthy. And as you probably have picked up on, potable, safe drinking water that is probably the globe's number one concern, and we want to protect our water as much as we can. And this one, number 4, is true. Today's solutions may be tomorrow's problems, and we see that with what we've done to some of the waterways and our earth itself. I'm just going to point to the 4 areas where pollution is significant: the air, the water, the land, and our food. And as you read again through content, you're going to see something called a point source. So let's look at air. When we talk about point source pollution, these are fixed structures, so like a smokestack that is belching, fumes out into the environment, whereas a non-source point would be what we have from vehicle emissions. In fact, The greatest source of air pollution is motor vehicles, followed by burning of fossil fuels and waste incineration. When we look at our water, again, we have point source, and that those are discharges from industry and wastewater treatment systems, and then non-point source would be storm water, um, runoff from chemicals added to the soil, runoff again from additives to farm produce and animal diets, things like antibiotics and growth hormones. And then our land, we certainly want to think about how our soil is affected by the water supply that's used to irrigate it. People added chemicals and pollutants from the air. And then the final one, our food and how important it is for it to be safe for our consumption. It's not only the prep that goes into it, but certainly concerned as, and these have risen over the years, the last decade for sure, the use of antibiotics and growth hormones and pesticides on the crops and for the farm animals in their feed. So those are just significant things that you want to think about. On the next page, this is really where I want you to think about that environmental history. If you look, one of the recommendations is to use this mnemonic I prepare. And what that stands for, as you read in your text, is that you want to, first of all, investigate any potential exposures that a patient may have. You want to look at their present workplace. Is that a source of contamination? Where do they live, their residence and neighborhood? Are there environmental concerns in the area? A past workplace that could have, again, been a source of exposure? Activities that they're involved in, recreational, and then do we need to refer them somewhere? And we have lots of resources in the community, and then also to educate them so that they can protect themselves in the future. Someone on the discussion board also referenced a site called ToxNet that is from the National Library of Medicine. And this is actually a website that you can look up your zip code and see what kind of environmental exposures have been reported. So that's something that just to keep in mind. The next PowerPoint on page 7, um, just to recognize that along with that ToxNet, there is something called the Consumer Confidence Report, and this is also something that allows citizens to look at various um, data about the water supply in their area, especially if it's a municipal water supply, and other environmental issues. So keep that in mind. One of the things that I'm going to try to load for you is just an example of what's called health risk mapping. And it would be to take a geographic area, and the one I have in the presentation that I use for my face-to-face class is that I have a piece of a city map, and also, and it's only, it may be a 6-block radius, but then also an overlay that marks houses that were built before 1978, and that year may be significant, or you may recognize the significance because that's when we in our country took lead out of paint. But houses built before then are very much at risk for having lead-based paint in them. Then another overlay would go over that to plot houses where kids live that are under 7. So if you have an older home and young kids living in that house, they are a good example of a potential at-risk population. So that's what health risk mapping does for us. Another interesting fact about epidemiology, and again, there's a lot of good data on the chapter on the environment, so please take your time and really read through it so that you can utilize it when you care for patients in your practice. As you move further in the PowerPoint, we're going to really look at what epidemiology means. And one of the interesting concepts, or facts, I should say, that we have to think about is what we call the father, or who we call the father of epidemiology. And this isn't in your PowerPoint, but it is in your textbook. And it was actually John Snow, and he was involved in the cholera outbreak in London in the mid 19th century. And the thought at that time was that people were becoming ill, and cholera just causes a very intense um, diarrhea and gastroenteritis, which a lot of people would die from. And they thought it was from the air. They called it miasma, which meant bad air. And he's the gentleman that really figured out that it was actually a contamination of this bacterium, Vibrio cholerae, to the water source that the community was using. So the well that they were pumping their water from was contaminated with this bacteria, and that's why everyone was becoming so ill. So he really is looked at as father of epidemiology, because he investigated and really um, found the source of the contamination, and then would lead to eventually treatment for this terrible disease. Um, Another thing that I want you to think about that really is so important when we look at epidemiology is that, and this, if you look, first of all, if you look at page 24, um, you can see something called the epidemiological triangle, and that is just significant in when we look at this science to determine what is occurring and why people are becoming ill. And another thing that I want to point out to you is that while epidemiology started with uh, the ability or helped us explain infectious disease, we now use it to help look at why people are injured in the community. We certainly can use it in an environmental investigation. That absolutely would make sense to do that. Um, if we think about investigating and making decisions about things like um, an outbreak of some kind, and really what I'm referring to is more of a terrorist or a chemical, a bioterrorism outbreak, and again the kind of syndromes that we may be seeing, and then investigating back and deciding what's causing it, and again how to treat these people. Um, so there's lots of different uses for now the science of epidemiology. If you look at the triangle, we always have a host, which is our patient. We have an organism in most cases, which is the communicable disease. But again, think of it now, is there something if it were an environmental injury or just an injury per se? Um, what's in the environment that is causing the injury? And then the other component is the environment itself. And again, what is it that makes the patient susceptible to this kind of disease process? Or again, some other kind of healthcare issue. So again, the host, let's talk about a communicable disease. We would have our patient, the organism, let's think about cholera, that would cause the disease, and then certainly the contamination of the water supply was the environmental change that we saw. If we look at injury, I think about injury in the elderly, that's our host. Maybe we've seen an increase in falls if they're out walking in a residential community. So maybe the causative agent is broken sidewalks. And then the environmental changes would be that the surrounding municipality does not want to spend the money to fix the physical structure. So those are just some good examples of that. Um, Another thing, and we've looked at this elsewhere in healthcare, but it talks about the web of causality, and this is another mnemonic called the beings model, where if we are looking at a person that is suffering from some kind of illness or disease or complication, we have to look at their biological and behavioral makeup, the environment they live in, their immunological status, their nutritional status, which is so important, genetics, DNA makeup, and again, nursing is really, and Healthy People 2020 is really um, making a concerted effort to include um, genetics and genomics in nursing education. And then finally, services that they are involved in, social activities and spiritual activities as well, so religion. So all of those are important. Um, the other thing that I really want to emphasize, and this is not in your PowerPoint, but I want you to think about, um, epidemiology also looks at what we call the natural history of a disease. So you can split that on a timeline into three sections. The first one being pre-pathogenesis. So this is where we have a completely healthy or uninjured individual, but they may be susceptible to things. And we understand that from the research that's been done. Just easily think about people that could develop cardiovascular disease. They don't have anything going on now, but we know through the literature and all the data that we have that if people are eating healthy, if they are exercising, if they're controlling their stress, that's going to help prevent disease, or hopefully later on in life. As a disease progresses, we then move into what's called pathogenesis. And there are two stages of this. So the second middle stage is really where we've had some impact on the body. There have been adaptations that the body has made to manage this, but there are no outward symptoms of disease. Um, but again, certainly this would put that patient much more at risk for further development. And then the last section or stage is really the disease point. So this is where we start to see symptoms and that we know that the patient is ill or has been injured. And again, think about the other um, categories that we talked about. We can apply this all the way along these three areas or timelines. What I want you to think about then is how easy it is when we have that knowledge to take what we know and first of all, our pre-pathogenesis stage would be where we implement primary um, levels of intervention or the primary level of intervention. So we're going to do health promotion, illness prevention, and try to keep this patient as healthy as we can. The second or middle phase where we have pathogenesis that has no symptoms, but the person has made some adaptations, this is where screening really is plugged in and where we can really make an impact because now we can pick up on some kind of problem that exists and do something about it because still our patient can recuperate and be healthy again. And then in the last stage, our third stage, which is the disease state, this is where we put tertiary care in. So if you understand the natural history of disease or complication in healthcare, you can easily plug in the kinds of levels of prevention that would be appropriate for patients along the spectrum. So I think it just makes it um, I think it makes it very clear and understandable, and I hope that's something that you think about as you work through, not, for instance, when you are putting your community nursing care plan together. Um, Let me see if there's anything else that I want to call your attention to, and then just a couple of final comments um, as we end. And I think that was it. Okay, so if we go back to our historical perspective, think of our nurse leaders in the past. Certainly, Florence Nightingale looked at how the quality of the environment affected health. And again, this is such a big piece of epidemiology. And also, Lillian Wald and Mary Brewster really worked tirelessly to improve the tenant living that um, their citizens that they were working with um, were involved in. Couple of things that I'm going to also make or try to make available. There is a great web-based game called Outbreak at Water's Edge that I will try to upload onto the site this week. And if you want to take it, might take you about 20 minutes to move through it. And if you really take the time to investigate what's in the environment and the people that appear in the program, it will give you a good idea of really epidemiological investigation of an outbreak. And so it's kind of fun to do. And lastly, I will also upload just a very short matching game because you're going to run into a lot of terms when we look at epidemiological work that gets done and all of the different definitions that we have for different health states and really a whole variety of them that are listed in your PowerPoint. So I'm picking out a couple that I think are important and just having you really understand the definitions. There are many of them in your presentation and in the textbook. The ones I want to emphasize and the ones that will be on the game are things like morbidity and mortality. Incidence and prevalence of disease is important to understand. When we talk about the rates of different kinds of life events like birth, death, um, that's also a very important term to consider. And you will see it as you read through research articles and those kinds of resources that you have available to you. So that'll be test your knowledge on epidemiological terms. So I'm going to end here, and please enjoy the content on the environment. It is just such a critical piece, and really thinking about some of the resources that we have, the EPA that really, the Environmental Protection Agency that really helps establish regulatory standards for our air, water, in particular, the FDA, which looks at our food quality. The U.S. Department of Agriculture does the same as well. So there are many governmental agencies that are involved in trying to protect our environment, but they struggle too because there are lots of forces that try to lower these regulatory standards to make companies more profitable, and so it's kind of an unending battle in government to really protect our citizens and allow industry to make profits as they, are engaged in many of the industries in our community. This week as well, you'll be uploading your windshield survey, and I look forward to looking through those. Karen from the library has sent out instructions about how to compress your file if you're having problems uploading a large PowerPoint presentation. So please look at that and keep me in the loop, and I will be in touch over the next week. So enjoy the content.